Good morning. This is a new paper, a new topic for this series. And the reason why it's a new topic for the series is that in 2008, we didn't yet have the appellation nutrition sensitive. We have been doing this kind of work for many years, but there was no name for these types of programs that we are reviewing in this paper. And what prompted the new generation of programs and for us to review these types of programs is the Lancet series from 2008, which showed, as this one shows again, that there's just so far we can go with nutrition-specific interventions. We cannot really resolve the whole problem of stunting with nutrition-specific interventions. So we need to do better. We need to do other things. And papers 3 and 4 are looking at what other things do we have to do in order to accelerate progress in improving nutrition. So you have seen this, and you will see it in every single presentation except for Zulfi's. I think what I just wanted to point out is a reminder that we are, in this paper, addressing the nutrition-sensitive programs and approaches. The green box. This box actually includes a lot more of these kinds of programs than the ones that we've reviewed in the series. But basically what has been said, Bob described this conceptual framework very nicely this morning, and the importance of these types of programs is that they address the underlying determinants of malnutrition, or also of fetal child nutrition and development. So they are the types of programs that we can rely on to create an environment where children can develop and grow. They're not normally specifically including nutrition-specific interventions, but we're trying to also get to that point where they become also a delivery system for nutrition-specific interventions. So the nutrition-specific interventions do not need so much of a definition, but in the paper we made sure that we had a definition just to clarify things. So there are interventions or programs that address the immediate determinants of fetal and child nutrition and development, and those are all the kinds of, well, they are actually the interventions that Zulfi discussed before. For the definition of nutrition sensitive, we had to do a little bit of consultation and discussions. We worked with our advisory committee on that, and we worked among ourselves to agree on the definition because this was still not that clear. We had an idea that there were programs that address the underlying determinants of nutrition, like programs that address food security, income, that deal with adequate caregiving resources at the maternal, household, and community levels, and improve access to health and to a safe and hygienic environment. But we added that these programs also have to incorporate specific nutrition goals and action, because we don't want to give the impression that by just addressing the underlying determinants of malnutrition, we are improving nutrition. We know this is not the case. They're necessary, but not sufficient. We need to do more. And so incorporating specific nutrition goal and action is important in that definition. These programs can serve as delivery platforms. That's also the other concept, is that they are not just there, but they can also, we can also integrate specific nutrition interventions, and they become a delivery platform that helps us increase the scale, the coverage, and hopefully the impact of nutrition-specific interventions. So what are the pathways by which these programs can improve nutrition? One of the pathways is obviously through income. Programs like agriculture and social protection programs especially have a clear goal of reducing poverty, improving income. And so we did a cross-country analysis looking at analyzing the more recent data set to see what is the relationship between economic growth and stunting. So what we see here is this shaded area, and this line here is how much stunting declines with GDP per capita increases. We can see that overall we have this slope is a 10% increase in GDP per capita leads to a 6% reduction in stunting. And we can see that with the bubbles and the countries, that some countries are doing really well. They're actually doing much better in terms of having lower rates of stunting than predicted by this multi-country analysis. Countries like obviously Brazil, Thailand, Colombia, Dominican Republic are doing very well, Sri Lanka, whereas you have countries in this space here that are doing terribly bad for the level of economic development that they have very high levels of stunting. So economic growth can take us so far, but it would take a very long time to wait for economic development alone to improve nutrition. The other negative aspect is that, and certainly unintended aspect, is that when you increase income, you also increase pretty dramatically the prevalence of overweight and obesity. And this graph is showing prevalence of overweight and obesity in women. And here, the increase is 7% increase in overweight and obesity in women with a 10% increase in GDP. Again, with some outliers in the positive that they do not have such a high problem of overweight and obesity given their economic development. And countries like Egypt, we know, is an amazing outlier where there's excessive amounts of overweight and obesity for their economic development. The next pathway by which these kinds of nutrition-sensitive programs, and especially agriculture and social protection in this case, can improve nutrition is through women's empowerment. What kind of evidence do we have that women's empowerment actually increases child nutrition and maternal nutrition as well? We have evidence, first of all, that men and women do not allocate resources the same way. Food income in the hands of a woman is allocated differently than food and other resources in men's hands. The kind of evidence that we have shows also positive associations between various dimensions of women's empowerment, and we do have problems with defining women's empowerment. We're making progress, but it still has many dimensions, and we don't have one indicator, obviously, except the Women Empowerment Index in agriculture, which is not complete. It's focused on agriculture. So what we have in the literature are clear positive association between different dimensions of women's empowerment measured in different ways and improved maternal and child nutrition. We also have negative associations between disempowerment, which is the ultimate disempowerment is domestic violence, for example, and there is quite a bit of literature showing how much disempowerment, domestic violence in particular, is associated with negative child development and child nutrition outcomes. And we've seen recently some positive impacts of different types of interventions, in particular agriculture and intervention and cash transfers, especially those that are targeted to women, have improved women's empowerment. So we know this is an important pathway by which nutrition-sensitive interventions can improve nutrition and can improve women's empowerment and in turn can improve nutrition. So the kinds of program, the types of program we reviewed, and keep in mind that we had a limited number of words in our papers, so we could not cover all of the potentially nutrition-sensitive programs. We focused on 4 of them. Agriculture, we looked specifically at targeted agricultural interventions at the community level. We looked at social safety nets, transfers in cash, conditional or unconditional, as well as food transfers. We looked at early child development because we do believe in Sally's points, and we also have been very impressed by the last Lancet, the 2 last Lancet series on child development that show the interaction between nutrition and child development. And we looked at schooling, and I will explain later on why we looked at schooling. Of course, it's an important determinant of nutrition, but what programs do we have? We selected these sectors based on their relevance for nutrition. That was the first criteria. The second criteria was that we wanted to have some indication, evaluations of their impact on nutritional outcomes. We were looking for interventions that have high coverage of the poor because we are, as I said before, interested in using them as delivery platforms to increase the scale and to reach the poor. And we also looked at interventions that were either targeting or could target the nutritionally vulnerable groups, focusing on the 1,000 days, for example. So starting with agriculture, the targeted agricultural programs that we looked at are homestead food production, dairy programs, home gardens, programs that really aim at improving income, livelihoods, and we have seen in the literature that they actually do that. They do support livelihoods and income of the poorest of the poor. They improve household food security. They've had impacts on diet quality at the household level and for some members in particular in the household. And there's also evidence that they improve women's income, control over income, and they improve certain aspects of women's empowerment. These programs are also important because they complement the global efforts that are made to stimulate agricultural productivity. We hear a lot about we need to feed the planet, we need to increase agricultural production in terms of quantity, agricultural productivity, we need economic growth that is fueled by agriculture growth in order to increase income and as well as to protect consumers from high food prices. The poorest of the poor are not part of these processes most of the time, and in order to help them be part of these processes, we need the small targeted agriculture programs that help them take part of the development process. The evidence of nutrition impact of these programs, in spite of all of the impacts I've mentioned before on household level food security and income, their nutritional impact is very limited, or we should say inconclusive, and I will explain why we call it more inconclusive. There is some evidence from some of the programs that were well implemented and well designed for example, homestead food production programs that have shown impacts on vitamin A intake and in some cases on vitamin A status of children. Not much information on impacts on women. And there is obviously, you've all heard of the strong evidence from biofortified orange flesh sweet potato. There has been 2 recently published effectiveness trials that show an impact on women's and children's intake of vitamin A that doubled with the OFSP, and also an impact on vitamin A status in children. So this is pretty much all the evidence we have of nutritional impact of these kinds of programs. And part of the reason from our analytical review of the literature is that there are obviously weaknesses sometimes in program goals, in program design, in targeting. They're not necessarily targeting the right age group for long enough. They're not necessarily targeting the 1,000 days or the mothers and young children. And there are also issues of implementation. In some studies, we have seen implementation of the nutrition part of these programs is sometimes the weakest link. And so there are reasons. There's also the fact that these programs were not necessarily designed initially to be nutrition sensitive. Some were, but others were not. As I mentioned before, nutrition sensitivity didn't really exist, and although we were thinking nutrition in some of these programs, not all of them that were reviewed had original nutrition goals. So there are weaknesses in these aspects, but the biggest problem we found was the lack of rigor in the impact evaluation. And this has been said. There's been many reviews of agriculture programs in the last 10 years, and they all conclude the same thing, that the evidence is really weak, unfortunately, because of the lack of rigor in impact evaluation and the lack of analysis of impact pathways, which would allow us to understand how and why these programs have or do not have an impact. Now, social safety nets. Social safety nets, we've all heard enormously about the conditional cash transfer programs. There are also unconditional cash transfer programs that are very common and popular now, and a lot of agencies are moving away from food transfers to cash transfers, for example. So they are widespread. They are currently, we estimate that they provide transfers to about 1 billion people, poor people, and they have been shown to be a powerful poverty reduction tool. They're often implemented at scale, hence the interest for us to tag along as much as possible, because they're implemented at scale and very often also have good coverage of the poorest of the poor. Certainly in Latin America, the conditional cash transfer programs were very well targeted and covering the poorest of the poor. And they've been shown, especially the conditional programs, to increase the demand for health services and education services. So they have a variety of benefits. They also help mitigate negative effects of global changes, conflicts, shocks. They're important to protect income, food security, diet quality, to protect assets, and also to protect investments of families in human capital. Those are effects that have been demonstrated. They also enhance some aspects of women's empowerment, again, when they're targeted to women especially, and when they include gender-focused or gender equity-focused interventions. So they are very important programs, and they have shown evidence of impacts on the use of health services. And this is not so surprising for the conditional cash transfers, because they are usually conditional on healthcare utilization. So this is not that surprising. What is surprising is that given all those benefits and given that they improve healthcare utilization, that they still have limited impacts. Globally, we see very minimum impact on child nutrition. Some studies, individual studies, we all remember the Progresa in Mexico program had some impact on child nutritional status, but this is mostly among the younger children, the poorer children, and among children that were exposed for longer period within the 1,000 days. So it all makes sense, but the evidence is not as strong as we might hope. But these programs, even more so than agriculture programs, often lack clarity on their nutrition goals or their nutrition interventions. Many conditional cash transfers were implemented just thinking, with all this package of giving the transfer and having conditions, they will have an impact on nutrition, without really having much in terms of nutrition intervention, except some pláticas, they call them, some little talks about nutrition. But this has changed, but we're reviewing the literature of older programs as well. There's also the fact that when you increase the demand for health services, if you don't increase the supply, then you can't expect to have so much of an impact on nutrition or health, and you don't find much impact on health outcomes either. But there's hope. Now, in terms of early child development, this is where, this is an area that was not meeting our 4 criteria, especially not the scale criteria. When I mentioned the criteria for including these kinds of programs in our review, certainly these programs have not been implemented at scale yet. The reason to include them was mostly that stunting and cognitive development share many of the same risk factors. And you see here, for example, nutritional deficiencies, intrauterine growth retardation, social and economic conditions such as poverty and maternal depression are joint common risk factors for both child development and stunting. And therefore, it makes sense to think of them together. They also share the period of peak vulnerability, the first 1,000 days. And as Sally mentioned this morning, it is a peak period of vulnerability for child development outcomes as well as for stunting, but it is definitely not the only period of vulnerability for child development outcomes. It is just an opportunity for combining the 2 types of intervention during that period. After this period, we need to make sure that child development interventions continue and tag along in terms of adding some relevant nutrition interventions. The key findings here is that there is evidence, but it's usually from relatively small scale programs that targeted either severely or moderately malnourished children, very at-risk children, which suggest additive or synergistic, in certain cases, effects on child development, much more so on child development than on nutrition. So those synergistic effects especially are found more on the child development outcomes. We still think that it makes sense programmatically and from a biological point of view to combine these interventions, and this comes back to the intervention that Sally made earlier, and it could lead to cost savings as well as significant gains in terms of nutrition and child development outcomes. So there is a lot of work to be done in this area, but there is a lot of work ongoing as well. Finally, schooling. As I said, schooling is not a program, but schooling is a critical input in nutrition. We know that everyone who's ever done a regression analysis looking at the determinants of malnutrition, maternal education comes up. When it doesn't come up is because nobody has education. It has happened to me that I kept saying, why isn't education significant in the Mozambique analysis? Well, because nobody was educated. None of the mothers had any education, or there was no variability in education. But it's clearly a very important determinant of nutrition. There are many pathways that we hypothesize are responsible for this. And we've done another cross-country analysis and confirm again that maternal education is even more important than paternal education, but both are important for nutrition, and that the risk of child stunting is significantly lower among mothers who have some secondary schooling rather than only some primary schooling. So any schooling is good, secondary is better. And schooling is obviously then important for the next generation. The key findings, we have positive trends in schooling. There's very nice statistics showing the improvements in the number of years of schooling achieved in both boys and girls, but more so in girls. We have a significant reduction in the gender gap in terms of schooling. In Bangladesh, I think even girls are more likely to go to school than boys now. So those are very positive trends that are likely to have major impacts in nutrition in the longer term. The other thing is that schools actually provide an opportunity to do more. School is already good. Going to school is already good. Education is already good. Why don't we do more in terms of incorporating nutrition in school curricula? There is health education. There are health programs in schools, but only a few and very, very remote actually have a significant nutrition curriculum. And having a nutrition curriculum could have several benefits. It could help prevent or treat undernutrition or overnutrition in school children. And it could also obviously help future generations with these children once they become parent, having better parenting skills. So we urge for more nutrition in schools and for assessments of the impact of these programs, these nutrition programs in developing countries on nutrition of the school child as well as on their parenting skills in 10 years or more later. So getting to the conclusion, we can see from this review that the potential of these programs is very large, but it has yet to be unleashed. There is very little evidence of real impacts on nutrition and a lot of evidence of impacts on all of the intermediary factors that lead to better nutrition. So we probably need to do more than what we've done up to now in terms of making these programs nutrition sensitive. As I mentioned, the programs, many of the programs we reviewed were retrofitted. They were not originally necessarily designed to be nutrition sensitive, so we need to keep that in mind when we review this literature and interpret the results. Whoops, I went back. So here, how do we make these programs nutrition sensitive? A few recommendations. Obviously improve the targeting, the timing and the duration of exposure to the intervention. We need the 1,000 days covered, but we also need to go back, as Zulfi was mentioning, to earlier. Adolescent girls need to be included, and the preconception period needs to be covered. Women need to enter pregnancy with better nutrition. So that is one way to improve the nutrition sensitivity of these programs. Use conditions to stimulate demand for services. This works, but as I said before, if you only increase demand and don't work with the supply, improve the quality of services, you're going to go only that far. Strengthen nutrition goals, design, implementation, all the things that we've seen along the way were deficient. use programs as delivery platforms for health and nutrition services. What I mean here is that these programs, for example, as I said, have possibly a component of behavior change communication, let's say. Very often this component is not particularly strong, but we could inject many more other nutrition interventions in there than just BCC. And so we could, for example, use them to reach adolescent girls with iron supplements, or pregnant women with their iron folate, linked to the health systems. There's a lot we can do with these programs to use them as delivery platforms in a more efficient way. And of course, we need to continue to optimize women's nutrition, make sure that the programs don't interfere with women's time and decrease their time for childcare. We need to deal with both physical and mental health of mothers. We know how important maternal mental health is for both child development outcomes and nutrition, and we need to empower women in every way and form. This is my penultimate slide. I just wanted to give a sense of a little bit of optimism as well, in the sense that we haven't given up. Of course, the quality of the evidence is not great, so we're not going to give up now. We need to give these programs a chance to be implemented, to be designed better targeted, better implemented, and better evaluated. So we have that ongoing. We hope to do more. We hope there is a momentum to do a lot more in terms of developing these programs and analyzing them in a way that we can understand what makes them work and what are the bottlenecks and how much can we integrate, how far can we go in terms of bringing new dimension to these programs without overburdening them. Should we co-locate? Should we give the same household all these interventions, or do we really have to integrate everything into one or two programs? Those are all important research questions, but we do expect that in the next 5 to 10 to 15 years, we will have a stronger body of evidence, because there's a lot of that research that's ongoing, and we need this better information to guide decision making regarding investments in these programs from relevant sectors, and relevant sectors include many more sectors than the ones we reviewed here. So in conclusion, just a few of the key messages. Nutrition-sensitive programs in agriculture, social safety net, early child development, and education, those that we've reviewed, have enormous potential. This potential is yet to be unleashed. They have the potential to improve nutrition. They have the potential to enhance the scale, the coverage, and the effectiveness of nutrition-specific actions. We expect synergies between working on the environment in which children develop and grow, and targeting also effective nutrition-specific action. If we focus on targeted agricultural programs and social safety nets, they do play a very important role in mitigating the negative effects of shocks and global changes. We know that we're living in a world of lots of changes and unexpected shocks, and they can help. They support livelihoods, they support food security, diet quality, and women's empowerment. And as I said before, they often reach the nutritionally at-risk populations who are left behind if we don't have these programs. Incorporating nutrition in early child development programs and in school curricula can benefit both nutrition and child development, and have long-lasting impacts into adulthood and for the next generations and nations. Investments in nutrition-sensitive programs can play a pivotal role in preventing the excess undernutrition and impaired child development that scale-up of nutrition-specific interventions cannot resolve on its own. We have seen that from Zulfi's presentation that nutrition-specific intervention will go only that far in helping us deal with the problem of undernutrition. We really need to do more, and nutrition-sensitive programs are part of the future. Thank you.
Thank you so much.